Once clients have been through the greeting triage station, they'll take their completed forms and move through the pod to the screening station. Screening is the next major function that occurs during pod operations. The screener role requires you to review clients' forms, use the screening algorithm to determine the appropriate MCM for each person listed on the form, and direct clients to the appropriate next station within the pod. As a screener, try to screen client forms efficiently to keep the flow moving. But remember, it's also important to maintain a high level of clinical accuracy. As a screener, you'll perform 3 main tasks. Task 1. Review the client's form for completeness before determining the appropriate MCM. The form you review will likely be divided into 2 sections. The first section will be filled out by the client, which will require information such as name, contact information, children's weights, current medications, medication allergies, or existing medical conditions. The second section will be filled out by you, the screener, which will require noting the appropriate MCM for each person on the form. It's important to remember each state has its own screening form, which means it's likely you'll see a variation of required client information. Depending on the design of the pod, the responsibility of checking for accuracy may fall on either the screener or staff located elsewhere in the pod. Ideally, other staff check for this as clients move through the line before reaching the screening station. Task 2. Use the state screening algorithm, which is a decision matrix that uses the client's responses on the screening form to determine the appropriate MCM for each person listed. Screeners verbally confirm any health conditions or factors that could affect the type of MCM received with the client. Those clients who are ineligible to receive an MCM at the pod may be required to go to a healthcare provider for further evaluation. If a client is eligible to receive an MCM, note on the form the type of MCM to be received and any other required annotations. Complex questions may need to be addressed by the screening team lead, supervisors, or other pod staff for further clarification and to prevent bottlenecks at the screening station. Task 3. Direct the clients to the dispensing area to receive MCMs and any relevant health information sheets. Depending on the MCM, screeners may direct clients to different dispensing stations within the pod instead of a single dispensing area. For example, some clients may have allergies to the primary MCM being dispensed, or are taking a medication that could interact with the primary MCM. These clients may need to be directed to a dispensing station where they can receive an alternate MCM or discuss other options with the appropriate volunteer or staff member. Because clients may go to different stations, it's important you know the criteria for who goes to each station. Most pods are designed so that the client will go to the dispensing station next, but be sure to confirm the flow of your pod with leadership staff. Because pods are different, remember that the responsibilities of the screening role at your pod may be slightly different and will be covered during the just-in-time training.